on Facebook.
All right. Well, hello, everybody. Welcome, all of you joining the Zoom. Welcome, all of you joining us on Facebook Live. My name is Erika Feresten, she, her. I am the Director of Healthcare for All Los Angeles, along with Maureen Cruz. Maureen, if you want to wave. And co-chairs Bronwyn Major, Chung Sim Lim, and Gina Harris. Healthcare for All Los Angeles is a local chapter of Healthcare for All California, a statewide nonprofit.
Bronwyn Major, Chung Sim Lim, and Gina Harris.
Sorry, there's some feedback there. Here we go. Sorry about that. So we are a local chapter of Healthcare for All California, a statewide nonprofit, nonpartisan organization. Our mission is to achieve a universal healthcare system through single-payer public financing with the goal that all California residents have comprehensive, high-quality health care. And so before we begin our program tonight, we are going to start off, sorry, I'm just admitting people into the Zoom here, with a land acknowledgement. So, we at Healthcare for All Los Angeles respectfully acknowledge that we live on the land of the Tongva and Quiche peoples. They have lived harmoniously with these lands and waters for countless generations before the onslaught of colonization. Like indigenous peoples across the Americas and most of the world, they experienced genocide, ethnic cleansing, theft of their land and waters, and forced removal. Our ability to live, work, and enjoy this area is connected to their deep loss. We ask all in our community, including our governing bodies, to respect the Tongva and Quiche peoples and to learn the true history of the lands on which we reside. We reserve to work with the Tongva and Quiche people to build a shared, sustainable future for all. And also want to acknowledge our fellow brothers and sisters in the Ukraine right now, and all of our brothers and sisters who are facing attack from oppressors outside of our country and within our own country. So much love there. And with that, I'm going to turn this program over to Director Maureen Cruz.
Sorry, Erika, I wasn't prepared. Okay, thank you all. It's lovely to have everybody here on Facebook and live on Zoom. So we'd like to ask our endorsed candidates to give us campaign updates, 2 minutes each, and we will be rude and interrupt and stop you at 2 minutes because we're on a tight schedule. So I'd like to start with Pilar. So we'd like just a 2-minute update from each of our endorsed candidates. So Pilar Schiavo. Pilar?
There. Yes, sorry. I'm making dinner and homework and in another meeting, and I got to turn off my beeper here. Sorry. Okay. So thank you so much for making time for an update. There's been a lot going on since I've last spoken with everybody, and our race is going really, really well. We definitely are the front runner amongst the Democrats, and with redistricting, this district is now plus 11 Dem. It was plus 4 when I got into the race, so that's a huge boost. But even with that, we know that we can't take anything for granted. And I wanted specifically to talk to you guys about my Republican opponent, who is the incumbent in this district. She is running a really, really tough race. She's serious about keeping her job, and she is specifically targeting Democrats and Latino voters and trying to peel them away from the Democratic candidates. And so we know that this is going to be a really hard fought battle, and specifically around single payer. She's one of the few Republican electeds who actually spoke out against AB 1400 after the bill died. So I just wanted to share a little bit about what she said, because I thought people would find that interesting. She said that most Californians access their health care through their employer-funded healthcare plans, Medi-Cal, Medicare, and Covered California, giving them choices not only on plans, but in doctors. AB 1400 abolishes these plans and creates a single government-run healthcare system, effectively eliminating patient choice. That's why I support a more inclusive approach that meets everybody's needs. So she's specifically going to be campaigning and attacking me on this issue. We just saw polling that she put out about this specifically, and we'll drop the link to her statement in the article so that you can share that. Oh, Jenna just did, thank you. But we're gonna really need everybody's help to be able to flip this district. It's gonna be a tight race. It's gonna be a hard fought race. And so for us to really take this district, it's gonna take talking to a lot of voters and doing, you know, as much as we can to make that happen. And so Jenna will drop links to volunteer. We're doing canvases every Saturday in the Valley and in Santa Clarita. We're doing phone banks on Wednesdays. HCALA can adopt your own phone bank night, whatever night you want to do it. We can work with you on that. But we really need folks to get involved in this race if we're going to win it. And we'll need all hands on deck to flip this district. So we hope to have you all with us. If you want to host a meet and greet or a fundraiser, we would very much appreciate that. We have been doing great on fundraising, but we're a little more than halfway where we need to be. And so we still have a long way to go and are trying to just make sure we have the most robust campaign to make sure we can win. So thank you again for the time, and hope to see you all on the campaign with us. Thank you.
Thank you so much, Pilar. Okay, we're going to stay up in the sort of the Valley area. Shervin Aazamik.
Can you all hear me okay?
Yes.
Great. I'm also turning down because I'm also in another meeting, the same meeting as Pilar. Very grateful to have HCLA's endorsement. In terms of an update, wanted you all to know that we've already contacted over 50,000 voters in our district through door-to-door canvassing, through phone banking, through text banking, through driveway discussions, little kind of informal, intimate meetings with small groups of voters, with their family, colleagues, friends, and also through our very targeted digital ads. Been able to actually connect with over 50,000 people, but we still have our work cut out for us. You know, this weekend we're doing a big, still planning a big canvassing event and call to action. The following weekend, just to give you all a sneak preview, Amy Valela, whom some of you may know, progressive candidate running for US Congress in Vegas, huge Medicare for All advocate. She was also part of the documentary Knock Down the House, if any of you all have seen that. Very tragic story about how her daughter died because of lack of healthcare coverage. She's going to be in town. We're doing a joint canvass, not this weekend, but the following weekend. And we're also ramping up our phone banks. I'll throw in the same pitch as Pilar. You know, we have all the scripts prepared. We have everything prepared. We can literally just plug you all in whenever you have time to do phone banking. And I also want to make a note about how, you know, while our district is very progressive and became much bluer with redistricting, according to 538, we went from D+18 to D+38. And of course, we voted for Bernie last cycle in the primary. There are other candidates in the race, other Democratic challengers who are running as progressives, even though they're not actually, putting forth the policies and the values and really highlighting it. And of course, their donors also do not speak to progressivism. But as we know, during midterms, driving out turnout is going to be super important. And what we've seen historically in our district is, you know, candidates even that raise no money, don't really do a lot of work, they'll still pick up at least a few hundred to a few thousand votes. That's how much people want to get rid of the incumbent. And so we got to be able to reach as many people as possible and really ensure that everyone knows we are the only progressive option. We're the only one that has the endorsements, that's taken the pledges, and is actively working on these important priorities. So I appreciate everyone's help on that. Thank you all so much.
Thank you. Thank you, Shervin.
Very nice. Now we're going to go to Daniel Wilson.
Hi, Daniel. So just a 2-minute update on your campaign. We are also on Facebook Live so that all of our viewers can hear from our endorsed candidates. So take it away, Daniel.
Awesome. Thank you so much, everybody. Thank you so much, HCLA, for the wonderful endorsement that I am super excited about, really excited about, as I was just telling Maureen, to see the magic that we can make happen together. So we have just recently qualified to be on the ballot. We have just recently qualified financially as through donations. So we are officially on the ballot. As everyone was talking about, the redistricting has shifted some things around. I feel very fortunate in our assembly district. I feel that it's actually shifted us more left and more progressive. Huge conservative portions of the county have been lumped out into another district. So I feel that in our last races in 2020, we had over 80% voter turnout and over 100,000 increase in voter registration from just the primary to the general in November of 2020. So our community is engaged, showing up and showing out in record numbers. And I am the only Medicare for All or CalCare candidate in the race. I'm running against the incumbent Democrat, and then there's a Republican candidate running on that government shouldn't run our healthcare. So as we're all here paying attention and watching and listening, our CalCare advocates, I am the only assembly candidate in this race that is 100% for and guaranteed to vote for CalCare and fight for it with every last breath. So we could definitely use any support. Website is votefordaniel.com. If anybody would like to sign up either to volunteer, we have a volunteer sign up for subscription, for email signups, and then also there's a contribution link at the top. We are grassroots, people powered, people funded. So every dollar helps, every dollar counts. We are getting our phone banking sessions started back up, so I will update you all with stuff on that. But if you sign up, we will email you all when the canvassing goes live again. So thank you all so very much. Excited to fight alongside CalCare, CNA, and all the wonderful people that are fighting to get us guaranteed healthcare for all. Thank you for your time.
Thank you so much, Daniel. Next, Mia Livas Porter. I think Nico is here.
Hi, everyone. Can everyone hear me okay?
Yes,
All right,
hi, Nico.
Well, first and foremost, my name is Nico, UCM pronouns. I'm one of Mia's campaign managers. Apologies that she could not be here. She's stuck in the middle of an endorsement interview, but she sends her love and wishes that she could be here as well. We're in a very exciting primary here in 8052, which is in Northeast LA. Redistricting added new communities to our district, particularly stretching into Glendale. So there's a lot of really exciting communities that we get to reach out to and have conversations with and build power alongside. We are the only corporate-free, 100% people-powered campaign in this district. And we are gearing up to win what I like to say, like the old-fashioned way, and just knocking on as many doors, talking to as many people, really just like organizing our communities, not just to vote for Mia, but to fight for all the progressive issues that we care about. Healthcare for all, universal healthcare, affordable housing, a clean, healthy climate. That's what we're aiming for. So we're ramping up our field operations. We're closely contacting about 30,000 people, and we're looking to just like grow that exponentially. So we are canvassing every single weekend in Northeast LA. It kind of cycles around, but it's aiming to make it accessible by public transit and just kind of making it easy to get there. And we're also texting and phone banking throughout the week. So if whatever way you like to reach out and talk to your neighbors about the issues that matter, we have a way for you to plug in. And of course, would love if HCALA could adopt like field events and just kind of like we can work together to build power and build our movement together. So again, deeply appreciative of your support and your endorsement. We're really excited for the fight ahead. And yeah, I'll go ahead and pass over the mic and I'll put my information and the website in the chat.
Thank you so much, Nico. Michelle Parias on behalf of Fatima Iqbal Zubair.
Hi everyone, yeah, Michelle Shihur. I'm Fatima's campaign coordinator, and Fatima, like many of our comrades, is at another meeting with Stonewall. I believe her race is the only one that had no consensus. So like all these endorsement meetings were like neck and neck, but our campaign is making some huge waves. I don't know if y'all have been following us on social media or emails, but Fatima was actually featured in a Disney Plus documentary coming out pretty soon in March. So we're gonna hopefully try to get some kind of event going where we can have some kind of screening. That's super, super exciting to be like shown on such a national scale. Also, Fatima was endorsed by Congresswoman Ilhan Omar, and she was endorsed by AOC's PAC, Courage to Change, one of 4 legislative candidates endorsed. So Fatima and just this movement, we're really being shown on this, national platform, and we're getting this national attention. Our movement is making waves. She was also on a panel with Bernie Sanders, hosted by Run for Something, talking to other prospective candidates on how to run if they're running for the first time or if they're considering running. And yeah, we've been going strong, knocking on doors. I've seen some of your lovely faces come out and join us. I do want to invite you all to join us Sunday, March 20th, which would be the next Healthcare for All LA Day and Fatima collab. I'm going to post a link there so you can RSVP. We are also going to be launching our phone banking. So, I know a lot of you live all over LA. If you can't make it in person, we'd love to have you at our kickoff, which is going to be on Tuesday, March 8 at 4 p.m. And yeah, I'll link everything like the Disney Plus documentary link so you can check that out, and I'll pass the mic.
Thank you so much, Michelle. Really appreciate all of our candidates. We love our candidates. That's why we endorse you, because you are the hope that we have that things will be better. So now we have a few announcements. I see Rihanna Shaheen is here from the Party for Socialist Liberation with an announcement.
Hi, everyone. So this Saturday, March 5th, the Party for Socialism and Liberation and many partnered organizations, including HCA LA, will be joined out in the streets in a rally to defend abortion rights and lift up the international struggle for working women's liberation. This will take place in Grand Park in downtown LA at 1 p.m. As many of you might know, today the Senate voted down the Women's Health and Protection Act, which would have ensured federal protections to those seeking accessible abortions and legalized it once and for all. So it's more important now, more than ever, to be in the streets to defend abortion rights and celebrate the spirit of working class, anti-imperialist, and militant International Women's Day this Saturday. So yeah, hope to see you out there.
Thank you so much, Rihanna. I'm going to give a pitch for the one-payer states. They have a conference, a 3-day conference called the Path to Universal Healthcare Through the States. That will be Friday, Saturday, and Sunday, March 5th through the, Friday, Saturday, Sunday. So it's 4th, 5th, and 6th. Before that, every night this week, they're hosting a film festival. So if you go onto the link that we're going to provide, you can join the film festival. They're showing a couple of films a night for the next week. Friday, a couple of the presentations are going to be the roadblocks and derailments of state legislation, which we are all well familiar with. And also, do we really have to kick the insurance companies out to get universal coverage? On Saturday, Gerald Friedman, economist, is going to give us the economic arguments for single payer. And there will also be a panel of the different states that are working for single payer. On Sunday, they're going to discuss the possibility of interstate pacts. And there will also be a presentation on the visionary and comprehensive public health model of CALCHA, which is the California Lifetime Care Health Act. So it's going to be a very exciting conference, Friday, Saturday, Sunday. It's one-payer states. Please, do yourself a favor. You want to learn some things and feel good that there are people on your side. Go there. All right. And Sukuru. Sukuru is here to tell us about an upcoming rally.
Thank you, Maureen. Yeah, so hi everyone, great to be here. So April 9th, we mean Cal Red Berets, which is a part of Nationwide Red Beret Coalition, is hosting a rally in Sacramento in solidarity with New York Health Act, and also a New York activist, Scott Denoyer. He lost his son on that very day, April 9th, to a suicide. He missed $20 monthly premium payment, and his insurance cut him off. He was suspended. You know, he couldn't get his medication that he needed for his mental health with known risks of suicide. So he drove himself into the river on April 9th. So in solidarity with his rally in New York, we as Red Berets nationwide are hosting multiple events. And I was inspired to have this rally in Sacramento, especially because given what happened really to AB 1400, and I really feel that not only, you know, to express our displeasure about what happened, but I think it's a great opportunity to get ourselves together and show, you know, solidarity across the state, and also like the, you know, what's to look forward to what's next. So yes, I know it's a kind of long distance from LA. Actually, there's a talk of organizing something in LA too, because not everyone can travel to Sacramento. So you'll hear more about this, but if you can travel to Sacramento, yeah, please do so. I'm shooting like 10 representatives from each assembly district. That'll be 800 people, right? So yeah, if you have any questions, please reach out to me. You'll hear more about this in the coming weeks, and yeah, so thank you.
Thank you, Sukuru. Could you put your contact in the chat,
sure.
in case people want to contact you? Thank you so much. And now we're coming to the panel part of our evening. I'd like to welcome everybody. Thank you for joining us for this portion of our meeting. We're talking a lot about war these days, and my question is, with at least 100,000 preventable deaths annually every year in the United States, and more individuals, families, and communities devastated by a health insurance caste system that leaves people traumatized, terrorized, sicker, or even dead due to delays and denials of care, is this not a war? This is a war against the people. Entire communities are impoverished by medical debt, preventable disability, and unmet need. This is a war against the people. And so we are here to organize. And have a conversation among allies and partners about how together we can create a sustained grassroots rebellion against the current corporate occupation of our lives and communities. So I would, both supporting legislation and a ballot initiative require a sea change in public advocacy for change. We've got to get the grassroots busy, aware, and organized. In 2023, CalCare will again be introduced into the legislature, and there is a ballot initiative effort underway right now for 2024. So our work is to get the public on board. And so I thank every one of the panelists who have joined us tonight. Each and every person that is here to join this conversation is someone who is an organizer and someone who is dedicated to an issue that intersects with the healthcare issue. So first I'd like each person, well, we're going to discuss two questions. The first one is, how can we work together, blending the urgency of healthcare justice with our allied organization partners, with the primary agendas of different organizations? And the second question would be, what concrete actions can we take together to grow the movement for CalCare, which will be reintroduced and which there will probably be a ballot initiative for. So first, I'd like to ask you each to please introduce yourselves, tell us something about your organization's major focus and how healthcare reform is related to the justice that you seek. I'd like to start with Baba Akili.
All right, good evening, everybody. My name is Akili. I'm the director of the Fannie Lou Hamer Institute, and the Fannie Lou Hamer Institute was started and founded to uplift the legacy, contributions, and leadership of Mrs. Fannie Lou Hamer, both in the civil rights and human rights era. And so that's what we've done. As a matter of fact, we just had a Black History Month celebration just 2 days ago, no, last week. And I'm also an organizer and core team member with Black Lives Matter LA and BLM LA. And BLM wants to end state-sanctioned violence in all its forms, social, political, and economic. So those are the two activities that I'm involved in. I think your question was around intersectionalism. And what was the second question?
Oh, well, we'll deal with the questions later. That was just a preview. I just would like to know how you see BLM LA, how you see the importance of healthcare reform to the communities that are represented by Black Lives Matter Los Angeles.
Well, part of it is connected to what we focused on doing in state-sanctioned violence. The lack of healthcare is state-sanctioned violence. I mean, you just listed a whole series of conditions that exist. So fighting to end state-sanctioned violence, social, political, and economic. So for Black Lives Matters, the lack of healthcare, particularly for Black people, is state-sanctioned violence, or certainly a form of state-sanctioned violence that that we have to, first of all, identify, remind ourselves about, and make sure that we understand how to eliminate it. I think part of what we and others have to do is help people see, understand, and accept that single payer is not even about healthcare. It's about financing, quite frankly. You get the healthcare, but what we're talking about is who pays it. An insurance company, which offers no healthcare at all, they only offer paper, versus another process, which is simply the people who do the work get paid through a single payer system. And so part of what we are going to have to do is struggle with people, first to help them understand that, second to help change the narrative, and thirdly, to help people accept that we're not about changing healthcare. We're really about changing healthcare payments, financing, and processing.
Thank you so much, Akili. Next, we have Michelle Verne from Feel the Burn, San Fernando Valley.
Hey, thanks for having me. I'm feeling a little under the weather because of allergies, because of the wind. But I am president of Feel the Burn, San Fernando Valley Democratic Club, and we fight for all social issues. And of course, healthcare for all lies at the root of all of those issues. Therefore, we really fought hard for CalCare, and continue to try to work for guaranteed healthcare for all in California, moving forward. And then what else was I going to say? Yeah, I mean, I believe that not having healthcare for all is not being free. So without true freedom, I mean, we can't have healthcare for all. You know, we have to have healthcare for all to be truly free, and that's really why.
Thank you, Michelle.
That's an important issue. Thanks.
Solomon Burke, when one of us is chained, none of us are free. So Steve Gibson. Steve, I'm going to ask you to do double duty, if you would. You are with DSALA, Healthcare Justice Committee, but perhaps you can also say a few things about PANA, since our PANA representative didn't. Oh, wait, our PANA representative is here. Never mind. Steve, just DSALA, Healthcare Justice Committee. This is Steve Gibson.
Thanks so much. Yes, DSALA is about addressing the problems of capitalism in our society. And so I think I can make a direct connection between why we can't have single-payer healthcare, why we haven't achieved single-payer healthcare here in California, with the situation of capitalism we have. We saw it. We saw when the people who have the money are influencing the politicians because they want the money, then that's why we can't get these bills passed. So it's a direct connection. And we can certainly talk about more about how we see ways to try to attack the issue. But that's how I think the connection between the issue and DSALA.
Thank you, Stephen. Taishi Miyagawa from PANA. Hello, Taishi. Oh, you're muted, Taishi.
One more button. Thanks for having me, everybody. I'm with the Progressive Asian Network for Action. I know most of the people here. We were born out of the first Bernie Sanders campaign when a bunch of new Asian American activists stepped up to join that Progressive Agenda campaign, and then again in 2020. And after the first primary, we decided to, stick around together and continue working for the bigger cause of full equality and political power for Asian Americans. I've also been involved in the Save Our Seniors Network that was initiated by PANA members also, as well as the Neighborhood Safety Companions, which is our on-the-ground community safety effort, primarily in Koreatown, to contend with the still growing epidemic of anti-Asian violence sweeping the country. Both of those issues are frontline healthcare issues, obviously, because we just suffered the closure of the only intermediate care facility in the United States that provided bicultural, bilingual servicing for Japanese American seniors. We had over 80 people that were evicted from that building with the full support of the California DPH, which is controlled by the California Association of Health Facilities. We pushed for a bill in the legislature of the state called Assembly Bill 279, which would have postponed these mass evictions until July 22. Our original contention was that it was quite dangerous to be evicting already immunocompromised seniors from 80 to past 100 years old in the middle of a pandemic. And CDPH felt it was okay to do so, even against the recommendations of 10 licensed physicians. That bill got 95% support in both houses of the legislature, and it was vetoed by Governor Newsom shortly before a legislative break, when he knew it was going to be hard to pull a veto majority back to Sacramento for one single bill. So we know pretty well the problems of oligarchy, capitalism, what have you. And I think the same goes for the anti-Asian violence situation happening right now, exacerbated first by former President Donald Trump when he started scapegoating Chinese people as being the source of the COVID-19 epidemic, using terms such as Kung Flu virus. That was basically a dog whistle to initiate open public violence against our people. But it wasn't just Trump, right? This is a systemic of white supremacy and the violence that our people have faced since day one to coming into this country, just like it is the history of all oppressed people in this country, which where we are at the foundation of this economy in terms of the super exploited sector of the society at large. Hate crimes under Biden have not subsided. They increased 339% nationally, and that figure is low. It increased 173% in LA County alone. And we know these figures are low because this is the thing I wanted to address, because some of us are doing actual community work on the ground. In 2 months, we've met with different senior apartment units in Koreatown, and through doing our street walks and outreach on the street, we've run into about a dozen people alone who've experienced hate crimes, and none of those were reported. So we know that data is low because there's many barriers to hate crime reporting. The seniors don't necessarily know what number to call. They don't necessarily have English as their first language, and none of the government agencies really give support, to the languages in our communities, which are pretty diverse, right? terms of healthcare, everybody knows that there's a unequal system called Medi-Cal. And, you know, a lot of our seniors and these privatized senior home facilities are being under attack because of the fact that the private operators simply don't get that much revenue from the Medi-Cal patients. They want to change them over to private facilities and increase their profit margins. So Medi-Cal patients get the short end of the stick. And that's kind of what the closure of the ICF in Boyle Heights was about. In terms of the anti-Asian violence, we can't wait for comprehensive single payer to be adopted, because we have an immediate issue of families having to turn to GoFundMe accounts to finance the medical expenses, which are quite exorbitant after your loved one's been in a coma for 8 months. This is going to cause financial ruin to many of these families. So we're basically right now focused on a subset demand, which is immediate financial aid to the victims. And we're fighting with the police departments as well as the establishment nonprofit industrial complex for these funds, because they want to divert them into post facto direction, meaning more staffing for police departments allegedly to improve hate crimes reporting, or 501c3s that want to increase staffing to improve their collection of hate crimes data, much of which is derived from police reports, right? Neither of which address the fact that a large number of hate crimes aren't even reported, right? And they're not addressing that. So that's a big demand. You could call it a subset demand of the single payer issue. We want healthcare, direct financial healthcare aid to the families of victims of this racist violence. We don't think that the burden of a societal problem on these families and victims should be borne by the victims themselves. It should be shared by this society at large. Thank you.
Thank you so much, Taishi. There is so much that you brought up, so much on your plate. And yes, you know, by the time you call the police, the crime is done. The hurt is done. So we need to work on prevention. Right?
I just want to add one context to what I'm talking about, and I think I would like to see that more in this group, is the question of building political power. If you look at the history of the United States, no major reform from women's suffrage to voting rights to civil rights, anti-war, none of those things were derived due to reliance on any politicians. They were derived from people that were basically outside of the system, right? By empowering the masses of people who are disenfranchised by a fundamentally corrupt system. And I think people need to challenge themselves to do a lot more of that work. Transactional politics alone, I support the progressive candidates on this call, and I support all efforts to elect progressive agenda candidates. But again, if you look at history, that's not really how change happens. We need those progressive people to get elected, but they're not going to have any power if we don't have power on the base, on the bottom. And that's what I think we need to do. We need to start building more mass organization like we used to have back in the day, to exercise community power from the ground level onto the existing political structure. That's it. Thank you.
Thank you, Taishi. Yes, everyone invited on this call is grassroots and about grassroots organizing, because you are right. That's where it has to happen, so we can support the people that we can finally get into office. It is really on us. Thank you so much. And thank you for your work. Everybody, thank you for your work. Tsukuru, you are here to tell us, talk to us a bit about the LGBTQ plus community and what's going on in terms of healthcare reform and how that intersects.
Yes. First of all, I just really thank you, Taiji-san, for your words. Really inspired to, say my piece, because like a lot of what you said really has a lot to do with what I'm going to say. So I am no expert on, first of all, LGBTQ health issues, except that I am, a transgender man who just came out last year, started hormone therapy in July, and learning a lot about, issues that our communities face. And as you guys know, what we are up against, especially, transgender community, is really, really serious right now. Like last year, it was the worst year in probably the modern history for transgender people in terms of like anti-transgender bills that introduced collectively like 147 anti-trans bills were introduced nationwide by 34 states. You've probably heard about Texas Governor Abbott essentially trying to criminalize gender affirming care for children. So crazy stuff is happening, but not only, this is like nothing new because transgender people, well, and LGBT, LGBT, lesbian, gay, bisexual people also, but, I just want to emphasize on transgender because that's what I'm kind of learning right now as, part of the community. So, so first of all, like we have huge challenges in terms of like employment. So because in this country, healthcare is tied, health insurance is tied with jobs. That's why like a lot of transgender people are disadvantaged at the disadvantage when it comes to having insurance. A lot of people do not have insurance because they may not have jobs that provide insurance, or they may not be able to find work or workplace that's trans friendly. And second of all, a lot of people, a lot of us have reservations, hesitations about seeking care because of, so when we transition, we, on the outside, we are presenting as like, for instance, I'm not fully transitioned yet, I guess, that's a kind of weird thing to say, but anyway, but my appearances will change. So I may look like a man, but I will have like internal organs that's female. So throughout my life, I may be seeking care at the, OBGYN, for instance, but not everyone, not every doctor has a good understanding of our challenges, our issues. So statistically speaking, a lot of transgender people are very likely to delay care because of a hesitation or not seek care at all. So, these are the issues that we are up against. So I think, for sure, if there is healthcare, universal and single payer healthcare, and especially, the bills like AB 1400 that has a, cultural sensitivity, written into a bill, that's really a huge thing for us, LGBTQ people. So I think that, going forward, I think just like any minority communities, really kind of like a very, what should I say, very focused approach is needed. I think, town halls, like cater to LGBTQ or like even like transgender community, or so, I actually have a lot of resistance, like lumping everything up into LGBTQ because we have different needs. So like, town halls for transgender folks, non-binary folks, that'll be great. I think we need a focused approach.
Chukuru, that is one of our topics. It's going to be our second question is specifics. And I like that idea of town halls because we need to get out to everybody. Thank you so much. Robert Schaefer is here from Sunrise Movement. Hi, Robert.
Hello. I don't really have too much to report at the moment.
We just want to know, just tell us about Sunrise. Tell us about Sunrise, the focus of Sunrise, and then, if there's a way you think climate action, for instance, intersects with healthcare reform.
Yeah, absolutely. I think it could be quite hard for many Americans to really think about the prospects of climate change and other existential issues when they can't pay their medical bill. When they're saddled with medical debt, many Americans will be thinking, how do I pay this off? So certainly helping form a Green New Deal, a coalition for a Green New Deal would be, in our opinion, the best way of proceeding forward to make sure that whatever policies we pursue in regards to the environment and climate change, we make it with, we decide it with the working class in mind, and that they all get to benefit from this as well. And we really don't see that there could be any other option for that.
Thank you, Robert. Really appreciate you being on with us. Okay, I'm going to ask the first of two questions, and this is more like a conversation. So maybe just put your hand up, panelists, if you, when you want to say something about it. And the first question is, how can we all, with our different organizations and different urgent issues, how can we work together for healthcare justice as partners, including healthcare justice in your primary agenda? So you can either just, if you go on the participants, you can raise your little blue hand. If you go up to your, whoops, wait, do we have participants in there? Yeah. If you go to your name and where it says more, it should say more. You click more and scroll down to, oh, I don't see removing the hand.
It's yeah, it's under reactions, but I did see Michelle Verne raised her real hand. So did you?
So reactions. I see. Okay, can raise your hand with reactions. So Michelle.
I believe it's what we're doing now, bringing organizations together that all intersectionally have that link to healthcare, right? So like we did with the MLK March, when we got together with all those organizations and we marched with them. We continue to do actions with them, and they in turn do actions that we have. We join together to create this big movement. And in doing so, there can't be any exclusivity, right? We have to be able to include every organization that believes in that fight, and not exclude anyone. So, and come together on that which we agree on, which we all, 80% of us know that we all agree on this, right?
Yes, we've heard the word capitalism, we've heard the word grassroots, we've heard the word freedom, and
but
care.
yeah, I mean, we're doing it. It's just we need to do it more. You know, that's what I think. We can have town halls, marches, everything, shows, even, right? Like when we did that video, we need to bring all organizations in to do the video. We need to have hundreds of us in on that video. All the creative activities that Feel the Burn did for AB 1400, we need to have everybody in on those activities. And now I know that we were in the pandemic and it was hard for all of us to get out, but I firmly believe communicating one-on-one, face-to-face, is the biggest way to educate people and get them involved. Yeah.
Maybe put your hands up on your screen, because for some reason I don't see the hand up, the little blue hand working. So does somebody else want to say something? Betty, did you have your hand up?
I see Sakuru has her hand up.
Oh, Sakuru, you have your hand up?
And then Taiji.
Yeah, I do. Taiji, some may have been, before me. But anyway, yeah, I'll be sure. I guess I'll be brief. But yeah, no, I totally echo what Michelle said. And on that note, I think, okay, so I'm from anti-militarism, anti-war, anti-nuke movement originally. I think everyone, not only like healthcare justice groups, but like for instance, Sunrise is here today. Anti-war, anti-militarism, anti-nuke movement should be included in, and invited to healthcare justice movement, because I see like anti-nuke as a healthcare issue. I mean, healthcare issue, anti-militarism healthcare issue, So, yeah, like events that I host in San Francisco Bay Area, Code Pink is actually a regular participant, and I think it's really not really far-fetched to build these bridges. So I think we should be, extending our hands to different movements. So yeah, that's all I wanted to say.
Thank you, Tsukuru. Taiji.
Yeah, I think just to sort of extend what I was trying to get into earlier, we have to suffer through this crap of having AB 1400, pulled because it was about to lose by double digits. I'm in the minority. I'm not a Ash Kalra basher. I'm familiar with the legislative process enough to know that when a legislature that's carrying the ball on a bill knows it's going to get its ass kicked, I personally am grateful to him that I didn't have to deal with the next day of having to deal with the cynicism that we already have in our communities about any kind of reform change. And so I just wanted to say that, agreeing to disagree with others here possibly on that point. But the reason why we didn't have the votes is simply because we don't have enough power up and down the state. We haven't done a comprehensive power analysis district by district to assess how we can get a critical mass of progressive agenda candidates and elected, and how that's going to be able to shape and dictate the dialogue enough. I mean, we're constantly moving that direction, don't get me wrong. I understand it, and that's why we have some of the candidates here tonight. But I think we have to face the tough questions and get real with ourselves in terms of how we take responsibility about our own objective political power right now. I mean, El Muratsuchi, who, we worked with, he co-authored that AB 279 bill that I referenced earlier, and a number of other senior home care legislation proposals that I know the California Health Foundation didn't like, right? So there's like this room where somebody like El Muratsuchi was aligned with our community's interests. But on the other hand, he's never taken a public stand in support of AB 1400 or single payer, because I'm pretty sure he gets a lot of, private insured donations to his campaign. And Torrance is like the closest thing to an Orange County district in Southern California as any. And there's a lot of conservative pro-police, pro-big pharma, pro-insurance company forces in that conservative community. So I get it, right? But the point is that, we have people in Pana that whine about El Muratsuchi a lot, right? For good reason, but the whining isn't going to get us anywhere, right? Unless we have the power to produce a candidate that can defeat an El Muratsuchi and put somebody better in there, all that whining about the evil neoliberals isn't going to do a squat, right? So I think the challenge that we have is, how do we build that kind of power? And I wouldn't be here right now. I just want to say that I wouldn't be in this space right now if it weren't for members of Healthcare LA that have demonstrated solidarity with their feet, coming out to Boyle Heights at our different actions to try to save our seniors from eviction. And I'll just be frank, that's a very small minority of the current Medicare for All movement, right? There was a few DSA members that came out and a few HCA LA members out. But in terms of the rest of the Medicare for All movement, they haven't shown up. I've got no faith in them from a solidarity standpoint that they're going to stand with us. They didn't come out to our rally we had to honor victims of anti-Asian violence Wednesday, right? I mean, it just doesn't happen. So the majority of white people in this country, even though they're behind aspects of the progressive agenda, I'm just being frank, they're not being for real when it comes to taking a stand against full equality, right? And I already told you about these frontline issues that we're facing. Akili, of course, with the Black Lives Matter situation and police killings, economic justice situation. Sunrise Movement can talk about the climate crisis, but within that, there's a subset of environmental justice issues where our communities are disproportionately faced by environmental pollution. I know HCLA, to their credit, has done a program on that. So, I mean, we have to move what is currently primarily a white Medicare for All movement over to the side of these fights of oppressed people for full equality, right? I mean, the Standing Rock fight against having oil polluting a major river on Sioux land, right? That was a healthcare issue, right? That was a frontline healthcare issue, So, I mean, all of the siloing, if you look at any oppressed nationality fight for full equality, you damn well bet housing, education, it's related to healthcare, right? So, I mean, we have to change the mindset, I think, of the Medicare for All movement. It's not just about winning the next single payer legislation, You know, it's a diversity of real world, real life issues that our community faces. And the white Medicare for All activists have to take a public stance with their feet in support of those fights. If we were to bridge that gap and that sense of disenfranchisement, that sense of abandonment that our communities have towards a majority of people who are affected by white supremacist thinking, right? So, and then the common thing that we all have is we're all stretched for capacity, right? I mean, you know, we all have to, Maureen's on email, shooting me emails about how I have to take care of myself because, you know, I've got back taxes I haven't filed and a bunch of other personal things because I got too many damn Zoom meetings this last week.
We'll
right?
visit you in jail.
Yeah. But I mean, I think things like showing up to some of the community events, right, that are sort of outside of the sphere of the quote unquote immediate single payer campaign is important. And I think we should look at how we can assist the oppressed nationality communities by whatever resources we can garnish out of this side of the movement. For example, if there's legislators that went on record the last round in support of AB 1400, let's have them prove it by financing a town hall. You know, let's have them pay for rental of that facility, right? Getting the chairs, right? Getting the staffing for that facility so that that space is presented, the audiovisual equipment is already paid for, right? And we can have a town hall to do larger scale education in the oppressed people communities about this issue. You know what I mean? That would be one way where we could combine resources and kill multiple birds with one stone. But let's go ahead and use the resources that exist that are held by elected officials that allegedly say they support this effort. That's one idea. But also more cold calling. We need to do more cold calling in local churches and groups that aren't necessarily deemed political, you know, but have social networks of people that are affected by the healthcare issue, and just kind of going a little bit outside of the box, you know, in terms of the type of programming we could do and the dialogue we can have with established community forces. That's it. Thank you. That's
excellent, Taishi. Yeah, I often wanted to go to the Black Barbers Association because they get a lot of people who will come and talk and come and have conversations about this. You know, you mentioned power, that we need to build power. And to me, one of the best examples of building power in LA right now is Black Lives Matter Los Angeles. I mean, what struck me, and I would love Akili to speak about this a bit. What struck me was the consistency. Every Wednesday, the message was the same. We are suffering. This is happening. People are dying. People are being killed. You know, cops are out of control. The message was the same. And it was every single Wednesday for, I don't know, 3 years, something like that. And then showing up at Garcetti's house, and actually getting rid of Jackie Lacey. Black Lives Matter had a result from their consistent messaging and showing up in the streets every week. So Akili, can you tell us something about that? I mean, how did you get the equipment? How did you get the streets closed? How did you do all of that? We need nuts and bolts here today. As Taiji, you brought it to the fore. We need nuts and bolts. Nuts and bolts. What can we do physically? How do we get out there into the people? So Baba Akili, please tell us all about it.
All right, well, I'll certainly try to keep it brief. First of all, Black Lives Matter is Black-centered, demand-driven, and direct action focused. The two, direct action and demands, are critical. So because we are Black-centered, we develop demands that are connected to the interests, understanding, and positions of Black people. And those demands drive us. And then we have to be engaged in direct action, you know, because the demands without the direct action is not quite enough. That's why, you know, Frederick Douglass talked about power never concedes anything without a demand, never has and never will. So that's a kind of understanding about Black Lives Matters. The other thing is that we believe in regularity and consistency. Even if there's only 2 of us showing up, we're gonna show up. And secondly, we don't ask permission. We simply do it. We don't, you know, and many of you have been have joined us on Wednesdays at 4 o'clock. We just take the street. We just took that street. We don't get permits. I mean, permits are for parades. I mean, we just, and we don't ask permission. The other thing is that part of it, we've taken a statement, Black Lives Matters, and turned it into a movement. In large part because of the energy that we have, the beliefs that we have, and the human resources that we have. So those are three of certainly of the elements. The other thing is that, and part of the reasons why I'm here and BLM has signed on to Healthcare for All is because you all have been reciprocating. That is, we look at relationships based on mutual respect, mutual support, and mutual benefit. And so if there is that mutuality and that reciprocation, then we look at how do we, what's the respect, what's the support, and what's the benefit? And the fact that Erika has participated, supported, and been involved in many key areas of BLM, like the People's Budget LA, like the Wednesday in Police Association, and representing Healthcare for All, means that we then have to look to reciprocate, that we have to look to, we got to respect. Well, what's the mutual support and what's the mutual benefit? So those are some of the things that we look at. Those are some of the things that we engage in. Those are some of the things that we, try to advance, But the other thing is we have a very simple, understandable message. Black Lives Matter.
Thank you. And our message is everybody in, nobody out, equally. No pay to play, and no lives are worth more than others. So,
let me, if I may, when Black folks hear all, when Black folks hear everybody, they know it ain't for us. And so part of my struggle over the years, and I've been involved in single payer activism since '89, maybe even before, but it's always to try to translate all into us, because that's the piece that's missing. When Black folks hear all, we know it ain't for us, because our history says it ain't for us. I mean, you can go back to Social Security. The National Labor Relations Act was written to exclude Black and brown people. So our whole history here is not one of inclusiveness, it's one of exclusiveness. And so when we hear all, we don't necessarily respond. Secondly, to make all real, there's a saying, when you take a group picture, the first thing you look for is yourself. Now that's not being selfish. That's just mean, there's all of us here. You look for how you looked on the picture. We have to see more Black people, more Black voices, more Black interest. Part of that, I think, has to be a way to struggle and connect the interest, understanding, and conditions of Black people, which is, the 4 conditions that we are faced with: white supremacy, institutional racism, individual bigotry, and mass denial. Those are the 4 conditions that we have to deal with. If you want to get and work with us, you got to understand them positions and conditions that we deal in, and we make choices. Can I get with Black Lives Matter today and Healthcare for All next week? I don't know. How does it affect Black people? We make the case, but we don't make the connection. So I think part of the work is, how do we make the case and make the connection? How do we get legitimate, creditable voices? And I'm going to try to be one of them. And then finally, how we build, sustain, and maintain relationships. Because in the end, organizing is about relationships. So how do we build, support and maintain these relationships? I think Erika has shown an example of how that can be. The other value of Erika and her participation is she participates based on the grounds, terms, and conditions of Black folks. A lot of white people come to us and tell us what we need to do. We know what we need to do, and we know how to do it. We don't always need people to tell us, lead us, and direct us. We can pretty much do that. If you want to be with us, then that's one thing. If you want to be allies, that's another thing. You want to be conspirators, that's another thing. But in all cases, Black people are going to lead. Black people are going to decide, and Black people are going to advance.
That's an excellent point, especially because the greatest victims of our healthcare system are the Black population due to the fact that we have a racist country and we are culturally white separatist. That is true. Yeah, what you're talking about, I think there's a term for it. I think they call it mediated cognition. When you've decided to be in denial and not see something right in front of your face because it makes you uncomfortable. And I would say that's definitely a virus that is running through the system for sure. So thank you so much, Baba Keely. It's really important, everything that you've had to say. Hopefully the people here on this call and those involved in our different organizations are going to write a new history. Every day is writing a new history, and we have to decide what that's going to be. Are we going to work together and be in solidarity and help one another, or not? Simple choice, yes or no. And if it's yes, what does that mean? Right? So we want to change that word all and make it mean all. That's our new history that we want to write. So does anyone else have anything to say? Stephen, do you have anything to say? Or Robert?
Yeah, I would probably touch on a little bit something similar to what Taiji was saying, which makes sense since I hang around him so much. But I like to see the Healthcare for All movement reach into new communities. I'd like to see language justice and the ability to reach communities that have not been reached very well by the Healthcare for All committee. So, for example, one project I hope to be leading here at DSA is a cooperative project with PANA and HCALA of translating materials into other languages, into Asian languages, into Spanish, so that we can reach communities that were not penetrating very well yet. So that's something I'm going to be talking to PANA and to HCALA about how we can identify what we can translate and get and pay for translators. DSA has some money, and we need to spend this money in ways that will help push the single payer healthcare movement forward. So that's a project I hope to work with all of you on.
That's fantastic. I know under SB 562, the brochure, the flyers were translated into Vietnamese, Korean, Chinese, I think 2 dialects of Chinese, Japanese, Spanish, Armenian. They spent a lot of money doing that translation. Question, do you think, my thought about that sometimes, yes, we need to get into the grassroots. What do you think about these AM radio stations that are in different languages, that address different communities, serve different communities? Would DSA be willing to look into that, doing, not necessarily paid ads, but going to these stations that are always looking for content and asking for interviews, and have people who are, bilingual actually be interviewed on these radio stations? What do you think about that?
Yeah, I think that sounds like a good idea. It sounds like a proposal that we should explore and do, because if we're saying we want to reach communities we haven't reached, we've got to try everything, and radio reaches people too that we don't normally talk to. So I'd be in favor of that.
People who really don't read. And besides, when you have brochures, you have to take those brochures places like farmers markets to get them to people, correct? But what we want to reach more people. Another thought that has come up in the past was billboards in different languages in different communities. Not waiting to put a billboard up 2 weeks before something goes before the assembly, but putting them up now. I mean, Healthcare for All has no money, okay? We have zip for money, but we know DSA has some money, and we know PNHP has some money, and we know there are pockets of money. And so we need to, what do you think about getting proposals together for finding ways to get into communities? Of course, churches. Under SB 562, we went to churches, but we probably need to go to people who are not on board with us. For instance, chambers of commerce, Optimist Club, the Elks Club, the I'm forgetting all the names of them, but there's so many of these clubs that kind of meet for breakfast. Now maybe they'll start meeting for breakfast again, but they may have been doing Zooms, and they meet for like half an hour, 40 minutes in the morning, and they want speakers. What about if each of our organizations could commit to doing a couple of things, like getting a couple of town halls up, or doing some farmers markets, or outreach to your local organizations, like I said, the Black Barbers Association, or any group you can think of that's in a community. And if each of us could commit to organizing something within our communities to promote whatever your main focus is, whether it's PANA, whether it's Black Lives Matter, whether it's Sunrise Movement, and connect it to the healthcare issue so that we can sort of get two birds with one stone, or many birds with one stone, right? We want to show that everything about human rights and everything about human dignity and everything about justice is related. And if we could put our issues together and come out for one another, as we've been trying to do, but make a real concerted effort, organized effort to do that over this next several months, because a new CalCare bill will be introduced. Now, do I ever expect it to go? No, but it's always an organizing tool, and it keeps the issue in the forefront. And we never know when push will come to shove and we'll finally get somewhere. So we can't stop, right? You have the choice of doing something or doing nothing, right? So anyway, I'd like some thoughts about that. Does anybody on this Zoom have anything to say? Any hands up?
I can say something.
Michelle. Oh yeah, Michelle. I have to say one thing before you speak. Michelle and Feel the Burn have come up with so many creative, awesome things. They have light boards and they show up at parks, at events at night with light boards, and she's done music videos, and it's really awesome. So I just have to give you a shout out because I'm so impressed with the work that you do.
Thanks. Hopefully everybody can start doing that too. I'll be honest. I'm not confident about CalCare. I have been trying to think about going down the ballot initiative route, and so I don't know about trying to do it simultaneously. Don't know what that will look like. But if we're gonna go the ballot initiative route, I mean, I think something's got to be, a decision has to be made, and then we have to go for it full-fledged. I think we could do it. It's going to take a lot of effort, but I'm just not confident that legislation is ever going to be passed for guaranteed healthcare for all. It's just, I worked in that industry for 30 years. These people are not going to give up. It's just, Yeah. So, and like, Taji said, the people, we need the people. The people in history have been the only way anything's ever been passed. They don't even talk about nonviolent action and how much good nonviolent action has done in history, because they know that it works. So, and they don't want us doing it. So, we've been having meetings. I've gathered with a group of people. Some of them are on here about trying to do this. And if any of you want to get involved, Betty, if you want to drop a link. But I just firmly believe that doing it this way is going through legislation. I mean, it's been years. if you want to really talk about it, it's really been 100 years.
Yeah, that's true. And this is
You
just
know?
the eighth attempt. This is the eighth attempt in 22 years. This
Yeah,
last one.
I mean, this is just.
But you know, I'm telling you, I've seen progress in the fact that people know what it is now. I don't want to take up too much time from my speaking, but because Baba Keely has his hand up and Betty has their hand up, and then I think we will finish. So Baba Keely?
No, I'll yield.
Oh, you're yielding. Betty.
Oh, okay. Yeah, I just wanted to follow up on what Michelle said. We do have a ballot initiative efforts underway. There are a few of us here on this meeting. We invite everybody to join us. I don't know what's going to happen with the bill next year. Who knows if the nurses will even, they say they want to do it again, but we don't know exactly what they're going to do. It's because it's all on them. It's all on them. They could change their mind. They might not have somebody to put it forward. Who knows what's going to happen. But I think building the movement will come from below and will come from all of us and will come from a surge of grassroots. And then being able to invite others in to have a voice and to collaborate and to understand all of the other communities, it would be, I believe, a ballot initiative would be more open to that. It would create that atmosphere as opposed to being behind the closed doors of our legislature that always fails us. Join us. We're doing this every not every Tuesday, but the 16th is our next meeting at 6:30. It's our third meeting, and we are actually looking at CalCHA, the bill that was put forth, that was going to be put forth before AB 1400 came about. But we're also looking at the other past legislations, including AB 1400, maybe have a blend of those legislations. I think that, if a bill comes out, we're only going to be able to strengthen their efforts, like Daniel said. But I'm not opposing, and I don't want to knock heads with anybody or any group that wants to go in that direction. I think we're all moving towards whatever happens first is first, or hey, the ballot initiative goes through and it's more robust than the bill. And it includes things in it that the bill would probably never, ever even reach and go to, like determinants of health, which hopefully our initiative will include. So anyhow, I dropped it in there. And also just to let you guys know, I'm probably will let you know further, but I work on the policy and education working group for the Poor People's Campaign in California. And they're moving to mobilize in Washington, D.C. In December. In June on the 18th, I believe, the 18th or the 19th. Anyhow, they're going to, the national campaign is going to swing through LA. They chose LA as their western point in May. And I want to help get everybody from the healthcare justice community to march and to walk and to show up. So just to let you know, and I'll give you some updates on that.
That's fantastic, Betty. I'm hoping everyone representing an organization on this call could commit to that. That would be great. That would be a great solidarity action together with the Poor People's Campaign. Can everybody give a reaction if you think you would like to definitely promote that, be part of it? Maybe get folks? Okay. Thank you. And I also want to plug again the one payer states. They are having some awesome presentations this Friday, Saturday, Sunday. And one of their segments is with the Indian Health Service and the Native American vision for healthcare. I think that would be a really important one. CalCHA, what Betty was just talking about, will be presented there as well. And also the ballot initiative, and also what does single payer really look like? Do we really have to get rid of HMOs and insurance companies? And I'm going to give you a spoiler. Yes, we do. We have to get them out. Okay, all the way. So Baba, did you have something to say?
Yes, very quickly. One of the things that certainly, I was a part of the '94 effort, and we learned some valuable lessons. And I think those lessons have been learned and can be applied. But there's a tactical advantage to putting out and gathering signatures for the ideal health, single payer system that we want, and taking the legislative approach. Because as rich and as capacity driven as the hospitals, the big pharma and the rest, they don't like having to fight on two fronts, one front legislatively and one front publicly. They would rather, particularly the public front, they would rather cut the deal in the legislative side. So the idea of having a statewide initiative, it forces you, first of all, to explain to people what single payer is in a way that because you only got 10 seconds to try to get somebody to sign a petition. And so you have to be rather succinct in what you're saying. So it forces you to do that. Secondly, it creates a sense of visible support. And then thirdly, it causes the legislators who don't like giving up power to the people, it causes them to look at how can they either head this off, stop this, undermine it, or get in front of it. So the idea of doing the dual approach of legislation and a statewide initiative could have some value, and you saw what happened with AB 1400 and SB 562. The message is the government is bad and we don't want them to do this. We have to come up with another message that talks about healthcare and what we want. And if we keep saying government healthcare, they're going to keep saying, and I heard this idiot talk about, well, you don't want, the same people who run the DMV to do your healthcare. And that was an argument. And people, emotions, like, no, I don't want to have to wait in the line for 3 hours to get my healthcare when I go to the DMV. We're talking about how do we pay the healthcare providers. We're not talking about healthcare delivery. We're not talking about healthcare choice. We're not talking about healthcare processing. We're simply talking about how the healthcare providers get paid. And should it be done through a group of people who spend their time denying your healthcare and payments when you need it? Or is it a simple process like Social Security? Everybody pays in, we all get it when we need it. And that proved to be a useful term in 1994. However, the wealthy, the hospital associations, the medical association, and pharma just outspent us, almost 120 to 1. But we learned some valuable lessons. So if you're going to do that, you may want to think about a dual approach. Have the ideal single payer healthcare system, be putting that on the ballot, and moving legislation.
Thank you, Baba Keeley, especially for all your experience. You've been involved in this longer than any of us. And I have to say, whether it is legislation and or ballot initiative, I'm with you. I'm for throwing all the garbage at the wall and see what sticks. We never really know what's going to take hold. But whatever the strategy, whatever the mechanism, at the base, it's grassroots. We have got to build the power, as Taiji has said, as you have said, as so many people on this Zoom have said, we have got to build the power. And that means grassroots, because if it's about money, we lose. If it's winning is just about money, we're never going to win, because they've got all those billions of dollars they stole from us, and they killed people to get those billions of dollars, okay? They let people die. So they're serious about keeping those billions. So if it's about money, we lose. So what do we have? Erika said it once, we have the people and we have truth. and we have some reality on our side. So those are the cards we have. Those are the cards we have to play. All power to the people. So thank you all. I hope that we will be getting together again and nailing down some very specific things. I love the idea that Betty brought forth with the Poor People's Campaign. I'm hoping that we can organize and all show up for that and bring our banners, Black Lives Matters, bring DSA, bring PANA banners, and let's show up in solidarity saying this is about what it is to be a human being. This is about human dignity. This is about human rights. This is about human life. And all of our organizations are centered on those issues. So I love you all. Anybody else have any last thing to say? No, that's good because it's late and we want to go to bed or at least have dinner, something. All right. Thank you so much. Thank you, everybody. Would everyone unmute and say goodbye to one another and say we'll see you
Goodbye,
at the
all.
We'll see you at the Poor People's March.
Bye-bye.
Yeah, we'll see you at the Poor People's
Good
March.
night.
See
Bye,
everybody
everybody.
soon.
Thank you.
Keep
So
up the good
much.
work.
Thanks.
Thank you.
Come to our next one.
Yeah.
Signing off. 5, 4, 3, 2, 1.